Hi, my name is Dominique Rash. I'm an assistant clinical professor in the Department of Radiation Oncology at University of California, San Diego. I specialize in gynecologic malignancies and breast cancer, and I'm really excited to be here today to talk with you about the HPV vaccine. So HPV stands for human papillomavirus, and it is a sexually transmitted infection. HPV can actually cause a variety of diseases. There's 40 different types of HPV virus, and so some types can cause genital warts, and other types can cause things like cervical cancer, vulvar cancer, penile cancer, and many types of head and neck cancer as well. Well, the HPV vaccine is frankly really exciting because it has the potential to decrease the risk of you getting not only genital warts, but also life-threatening cancers such as cervical cancer or head and neck cancer or anal cancer. There is no data to suggest that getting the HPV vaccine would increase risky sexual behavior amongst our teenagers. Even though it's hard to think about sexually transmitted diseases among such a young age group, over the course of our lifetimes, 80% of us will contract HPV. And so now is the best time to protect your children from HPV. Currently, it's recommended to get the HPV vaccine for all children, boys and girls, between the ages of 9 and 12 and up to the age of 26. You can also get the vaccine after the age of 26. Talk with your primary care provider and find out if that's the right decision for you. Even if you've already been diagnosed with HPV, you can still get the HPV vaccine. Currently in the United States, we're administering a vaccine that addresses 9 different types of HPV. So you may have contracted a type of HPV that's different what's currently being protected with the vaccine. So even if you've been previously exposed, it's still recommended to talk with your doctor about getting the vaccine. Both men and women are recommended to get the HPV vaccine because men are also at risk for contracting HPV virus and spreading it in the community, and getting the vaccine will decrease the risk for cancers for men as well, including head and neck cancers, anal cancers, or penile cancers. Oh my goodness, the great news is that the HPV vaccine is very safe. In fact, most side effects are just limited to a little bit of redness at the injection site. There has been found to be a little bit of lightheadedness among some women that get the vaccine. However, it's overall very, very low risk. If you want to get your vaccine today, talk to your primary care doctor and find out more about when you can get scheduled. It's typically at least 2 vaccines, sometimes a 3 vaccine schedule, and getting started right away is the best thing you can do.